Okay, welcome. So we're just going to go ahead and get started. Tonight's workshop through the Raising Wisconsin Parent Engagement work is on using data to tell our story. So we have Tessa Conroy here from UW-Madison, who's going to share some really interesting state level data, and we'll kind of talk about how to use that in our storytelling throughout the day. We are going to try to wrap up by 8:45. If people want to stick around to do Q&A afterward, you are welcome to, but we're trying to get people in bed at a reasonable hour. We know it's late, and thank you for being here at 8 o'clock. My first question for you all, so this is a quick rundown of our agenda, is just to do a quick homework check-in. So our October training, y'all came together, we did an overview of the childcare situation in Wisconsin, and then you were asked or encouraged to go try to tell your story to someone who is not also a parent. So this could have been like a coworker or your boss or just another friend or a family member. So I would love to hear from one or maybe two people about how that went. So who did you end up telling your story to and how did it go? Do you think there was anything that surprised them? Did it feel scary for you? Was it validating? So I'm going to pause, and I'd love to hear from one or two people who were here last month.
I can tell my story. So I told it to a group full of younger women after a meeting, and their reaction to it was just like, wow, I really don't want to have kids. And I was like, it's not all bad, but it's just rough. And I think, more people need to share these stories and these experiences so people know that this has to change. It's got to be better. And that's the only way, is to really tell people like, hey, everybody's going through this. And so you get some exposure to it, because they maybe had no idea, maybe they had a small idea, but it's helpful. And it's also helpful to just humanize everybody across the table, that there was other people there obviously that had kids as well, and they were just validating it as well. Like, yeah, it's super hard, super difficult. So that felt good.
That's a great example. Thank you. How did you find a way to bring it into the conversation in that group?
Oh, geez, you know what? I don't remember. Something probably came up that day, and it was probably earlier in the week, where I probably had to work from home. And I was probably explaining that to the group to be like, hey, this is the reason why I couldn't attend that meeting, was because I didn't have childcare that week.
Is that something that you normally would have done before kind of being intentional through some of this work? Or because I think a lot of people that I've been talking to have said that they've been telling their childcare story to other parents all the time, but it's sort of not outside that circle very often. So I'm curious if that felt like different for you or pretty typical.
It's pretty typical. I'm pretty open and honest about that stuff. When it's childcare related, that's just what it is. And people kind of understand that it's difficult, and some days you're going to have to work from home. So
yeah. So you scared off some people from having babies.
I did. I think I did.
Oops. But it sounds like it was also validating and helpful to share it out. Does anyone else want to share what their experience was telling their story? Okay. All right. I'm hearing silence, so I'm going to pass it off to Christy and make you do it on your own anyway. So we have 5 parent leads in each of the regions that we're working in right now. Last month, Sarah Shea from the Sheboygan area, we kind of spotlighted her. She told her story about childcare and why she's getting involved in this. And so Christy is up next. So we would love to hear from you.
I'm up next. Hi, everyone. I know a lot of you, but my name is Christy Cole. My pronouns that I use are she and her, and I live in between Mineral Point and Linden, Wisconsin, which is the traditional home of the Sauk and Fox and Ho-Chunk and Kickapoo people. I live out in the country. See, I have a spouse who is a carpenter. And as you can see in the picture there, I have a 7-year-old child who is, I think, has just fallen asleep. Her dad just came out of the bedroom, so I think she's asleep. Yeah, I spent most of my 20s working on small farms and my 30s doing hair. And now I am in grad school for social work. So I've always been a person who's kind of interested in policy. And after having a child, I had to cut back my work hours. I relied very heavily on my mother-in-law to help me continue to work. Like, she would take my daughter 2 partial days a week, and then I would just end up squeezing people in here and there for the rest of my work days. So that it felt challenging. I was a person who would not have known what a challenge childcare was before I had a child. So I definitely felt like I was aware of a lot of systemic issues, but that was what it just didn't cross my mind before it walloped me in the face personally. Yeah, we have a great community in this part of the state. Lots of really people who I think are interested in doing this kind of work, but haven't always felt like their voice has been heard given our political representation. But I do, yeah, I'm really proud of everyone in our area for getting together to start thinking about this one. So I don't know, is there something else I should talk about, Rachel, or?
I don't know. So what do you think is the hardest part about childcare in your area? From talking to other parents.
Yeah, from talking to other parents, availability is a huge issue. Alicia, who just spoke a little bit ago, is a friend of mine and in this area, and I think, I don't want to speak for her, but I think she might second that as well.
Oh yeah, that's fair.
Yeah, our daughters that were born a few days apart, so we've gone through a lot of this stuff at the same time frame. I think availability is probably the biggest issue. We don't really have much in this area for any kind of licensed childcare. It's almost all in-home. It's almost all informal. Heavily, if you go to our schools in the morning or at pickup time, you see a lot of grandparents pitching in to help out. So we don't have a lot as far as licensed childcare. And I know that's when people move to this area, that's one of the things that has come up. What are you supposed to do with your kids if you don't know somebody to watch them? And I know we also had a real terrible tragedy in our area where a child was killed in a abusive situation with in an unlicensed childcare center. So I know that has impacted a lot of people in our area, and I feel like we have people who maybe aren't here, but who are definitely on board with systemic change just based on that really terrible thing that happened in our community.
Yeah. I appreciate you sharing, Christy.
Yeah. Anybody, anything else?
Well, we're gonna have more storytelling time later, so I'm gonna pass it off to Jackie. Just, you ended it really well in talking about systemic change. And so there's a whole bunch of different ways that we can address the childcare situation. WICA's doing that work in other ways too, like supporting providers, getting people licensed, doing some of that work. But we are coming together around the state budget ask. And so Jackie Anderson, who is the director of Ways in Wisconsin, is going to talk to us a little bit more about that. And then we'll pass it off to Tessa.
All right, Christy, thanks so much for setting me up nicely, because when talking about systemic change, that's exactly what this is about. So as Rachel mentioned, WICA, which is Wisconsin Early Childhood Association, traditionally they've done some amazing advocacy for years, all supporting the ECE providers. So ECE is Early Childhood Education, if you ever hear that acronym kind of being tossed around. And part of what was happening was we knew that we needed to get more and more folks to really buy into the childcare crisis that we knew was happening way, way, way before COVID. and was just put a spotlight on during during COVID. I can't say after, because unfortunately we're still in it. And so what's happened is we have had so many different childcare programs that have closed, or they haven't been able to sustain staffing. So there's been like this horrible crisis that we're in right now. And one of the ways that the federal government supported our childcare industry was by providing federal financial support that in our state we call childcare counts. So what that meant was federal government gave money to the state then gave direct payments to our ECE providers, which meant that they could use that funding to keep their doors open. So oftentimes they were paying their staff a salary that was equitable and deserving. They also were doing things like reimbursing parents who potentially had to pay for their kids in the program, even if the program was closed because of a COVID exposure. So those are just like two simple examples. So we know that over time, and not over time, but in January of 2024, there's going to be what we call the fiscal cliff. So up to this point, providers have had that financial support. And in January, we know that all that funding is going to be gone. So what's going to be left is this gapping hole of finances that we need to ensure stays in those ECE providers' pockets. So I will tell you that this is not, unfortunately, this is not the systemic change that we are hoping would happen in the state of Wisconsin. But given our kind of where we are politically, we know that by asking for a $300 million childcare counts budget ask coming from general purpose revenue, we know that by using many voices, many of which you guys are on the call, like using parent voices, using business voices, using the provider voices, like all together saying like, we have to get this funding, it will at least keep doors open. And I'm saying that just to kind of be realistic in like thinking through, like if we could create a systemic change, it would cost billions of dollars, which hopefully someday we'll get there. But for now, we need to at least focus in on the childcare counts budget ask. So I'll just leave it at that. For more information, we have a really detailed white paper that I can put in the chat box that gives you all the data as to how the decision of 300 million came to, so that, you know, it's not just a random number. It actually will cover the finances for 18 months. And there's a lot of good data in there to really be able to show how that money will be used and how it's been used to date. So I'll drop that in the chat box for you all to be able to read a little bit more about it. And with that, I think I'm going to turn it over to Tessa.
All right. Hi, everybody. My name is Tessa Conroy. I am an associate professor and economic development specialist at UW-Madison. And I have been doing a little bit of research and thinking about childcare now for 4 or 5 years. I'll tell you that I only recently became a parent, and this actually started about, as I said, 5 years ago. And I have 2 older sisters, and I was observing the extent to which childcare was so closely connected to their working decisions. And as an economist, I'm thinking to myself, like, wow, is there a bigger story to be told here? Is this not just, you know, my sisters and 1 or 2 families? Is this happening across the board? And what does that mean for our communities and for the economy? So that was sort of my on-ramp to thinking about childcare. So I just have a few slides to share with you today. There's a lot more resources, of course, out there I'd be happy to share. I'll put a few things in the chat if you're interested. And otherwise, I'll just get started sharing my slides here. Let's see. Share is not working quite like I want it to.
It worked for a hot second there.
Okay, I think we're in business now.
Here we go.
All right, so. Okay, so as I mentioned, my on-ramp to thinking about all of this is really economic development. So what does childcare mean for labor force participation? What does it mean in the context of a labor shortage like we are in right now? What does it mean in terms of employee turnover and absenteeism? What does it mean in terms of places who are wanting to recruit workers into their communities, but they don't have childcare for those workers to come and have a safe place for those kids? So thinking about all of the ways this might be constraining our communities. As you know, this was an issue before the pandemic. So we did a little bit of survey work here in Wisconsin, and this was again before the pandemic. And we see that the cost of childcare was a major consideration for both men and women, but particularly acute for women. And we see this show up in a lot of ways, that this is especially a problem for women, though it affects male caretakers and dads too. And then on the right-hand side, I cut back on hours or quit a job because of the cost of childcare. And you see 51% of women, 42% of women, a large chunk of families impacted by childcare. During the pandemic, we asked some questions about childcare as well, and we see that this just becomes even more acute. So these are the responses for people to the statement that they agree the following have been harder during the COVID-19 pandemic: caring for children in general, pretty much equal shares of men and women; accessing daycare, again, pretty much equal shares of men and women; and then paying for daycare. You see just a slight uptick for women, but we have some information, you guys might have this already. During the pandemic, as many of 60% of child care providers closed, and the industry has been slow to recover capacity. You know, the best information I have is that we're about 90% of where we were before the pandemic, and before the pandemic was also inadequate. So the problem has only become more dire. Again, thinking about this labor force participation. So what I'm showing you here is a plot of the share of children under 5, so children under age 5 per prime age male, and then prime age labor force participation. So this is at the county level for Wisconsin. And basically on the y-axis, you have, you know, what is the share of, or what is the presence of very young children? And then how is that correlated with male labor force participation? And then on the right, I'm doing it for females. So what is the count or the presence of children under 5? And then how does that correlate with female labor force participation? And I think what you see here is a pretty traditional gender roles playing out, so that when there are lots of young children, we generally see men going to work and we generally see women staying home. And that's the story we get here, at least for Wisconsin counties. And when I say prime age, I'm talking about people aged 25 to 54, because that just tends to be the meat of the labor force, that we see really high labor force participation, upwards of 90% in these age categories. So, and this is also where we would expect likely children to matter a lot as well. So this slide is important to me because when we think about a labor shortage in the state and we think about, okay, who are the people that could be working that aren't, starting to identify those groups is really important. So we're seeing more people that with physical disabilities be engaged in work in ways maybe they haven't before. Maybe people who are recently retired start to come back into the workforce. I don't think we're talking enough about women when it comes to thinking about pools of people who could be accessing the labor force if their situation were just a little bit different. So here, I don't imagine that for all of these women, childcare is the constraint, but I do think it is for some of them. And across every single age group, we see that female labor force participation from 25 to 54 is lower than for men. And so the question becomes, how many thousands of women across the state might be joining the labor force if it were for childcare availability, affordability, and quality issues as well. So I think that there's a big potential to make a dent in the labor shortage by addressing childcare. Here's some statewide maps. So we're looking at the number of children under age 5 per childcare establishment. So I don't have data on capacity. I don't know about the number of slots, but I do know about the number of childcare providers, and they're formal childcare providers. So there's a whole informal aspect of childcare here that I'm not able to access if they're not filing formal tax records. But here you can see that across the eastern part of the state, we have really high ratios of children under age 5 per childcare establishment. It wouldn't surprise me at all if these are places with really acute childcare shortages. And then in figure 5, these are from a document that I put in the chat. We're looking at the expensive childcare for what's called a survival budget. These come from United Way. So what is the cost of childcare for households with 2 adults, 1 infant, and 1 preschooler? And you just see that a lot of the state, we're looking at anywhere from $1,200 upwards close to $2,000 per month in childcare. So this is for a lot of people competing with their mortgage. Their childcare expense is close to maybe 1/3 of household income. And so I want to tie that into affordability. Looking here at our next slide. So a rule of thumb that we often hear as economists, and maybe you guys hear this too, is that a household's expense on housing should be about 30 to 35% of their income, so about 33%. And that would be considered affordable for a given income level. And a lot of households are spending about that on childcare. And so is that affordable? Well, the current administration is saying that childcare is affordable if it's about 7% of income. So here I have some figures for you. These are from the Economic Policy Institute. So the average annual cost of infant care in Wisconsin is $12,500. There's a lot of spatial variation though. I imagine in Dane County and Milwaukee, it's a lot higher than that. And maybe other places a little bit more affordable, but that's the average. Then we have 4-year-old care in Wisconsin at $10,200 roughly. And then this combined cost of close to $23,000. The median family income in Wisconsin is $68,000. So that means care for 1 infant is close to 19% of income. If 7% is that threshold for affordability, we're far beyond that, what would be called affordable. And if you have 2 children in childcare, that could easily be, as I mentioned, in that range of 30 to 35% of your income. So far above what we would consider that 7% threshold for affordability. To think about things the other way around, if we assume childcare is affordable at that 7% of income, then for the average household in Wisconsin, the expense would be $7,500. So we're sort of backing out what an affordable cost of childcare would be. Or we could think about it, okay, how many households are there in Wisconsin for whom $12,500 is 7% of their income? And that's just 6 to 7% of households. So less than 10% of households in Wisconsin are footing a childcare bill that would be affordable by federal standards. Okay. I want to, though, also include just a little bit about the childcare industry itself. I think sometimes it's hard for us as parents to reconcile, like, gosh, I'm paying so much for childcare. How is it possible that childcare providers are just scraping by? And I do want to shine a light on just how low wages tend to be in the childcare industry relative to other places in the economy. So median childcare worker in Wisconsin earns $21,300. So that means if their child were to be in a childcare facility, it would cost 59% of their income. So childcare is just unreachable practically at this income level. And then this is some work from Berkeley, but they show that 98% of occupations pay more. So when we're in a context of a labor shortage, then it becomes really hard to retain or attract any sort of workforce when you see better opportunities almost everywhere else in the economy. And that's pay, but when we also look at benefits, just 17% of teaching staff are eligible for benefits. This is some work from WICA. It's a little bit dated now, but I have no reason to expect that it's dramatically different now. and only 50% receive paid days off. So in terms of pay, in terms of benefits, really difficult to attract workers. And we tend to need a lot of workers because we have state mandated ratios that you all are probably familiar with, and you need as many as 1 worker per 4 children for infants, or even per 8. That just is a labor intensive profession that we're looking at. And I think we want those people to be skilled and trained as well. So that requires paying them a premium to have that credential or that education to their name. In the box, this just gives you a comparison of how that $21,000 salary is going to stack up against minimum wage, just barely better than minimum wage at $1,580 or $15,080 for the year. It puts our childcare workers below the poverty line. And when we compare that to an elementary school teacher's salary, it's much, much lower. So just to sort of give you some useful benchmarks and understanding where childcare sits. I also want to highlight what this can mean for employers. Again, sometimes I think helping, for a long time, childcare in my mind has been packaged as a family problem, as a household problem, or even as a woman's problem. And I think this slide helps us maybe package childcare as an economy or as a business problem. And so here I'm showing that there are economic impacts for employers. There's some work showing that inadequate childcare can lead to lower profits because of reduced work hours, turned down promotions, quitting, dismissal, and demotion or transfer, all linked to childcare challenges. We also know that turnover and absenteeism due to insufficient childcare may cost businesses up to $1,500 per working parent each year. And then very last year, providing childcare, there was one study showing that providing childcare decreased employee absences by 20 to 30% and reduced turnover by 37 to 60%. So it's really expensive to hire, to do a recruitment, to train an employee, to get them to the role that is needed by a company. And if people are leaving, then we're just incurring those recruitment expenses more and more all the time. It's expensive to find people to cover. So I think for employers, there's a lot to be gained here. And if we think about when people are leaving the labor force for childcare reasons, they're often in this age range of maybe 30 to 40 plus or minus on either side of that, of course. Those are years where people have been at their job for a while. Oftentimes they've gotten good at what they're doing. So we're letting go of really highly trained people who have gotten good at their jobs, they're skilled, and they're having to step away because of childcare. And so I think this chunk of the labor force that is really productive, they've been trained, they are good at what they do, those are oftentimes the people who have to leave. And I think that helping show how that's costly for employers is an important piece of the puzzle. So I apologize if I feel like I'm just a little bit less than at the top of my game here at the 8 o'clock hour. So I hope I made sense. My son is also just going to bed, but I'm glad to be with you here, and I hope this is useful.
Well, and Tessa, thank you so much. I think the way you presented it is there is a lot of data that shows that like our ECE providers are not, they're using subsidy themselves. And, how can we go about changing those different pieces? So I love how you set up a lot of the data. And we have a lot of the data that is actually aligned with what you said too on our Raising Wisconsin website. So
Great.
I'll drop that link too, so that all of you who are on the call, if you ever want to use that in future conversations, you can make sure to download that too. So Tessa, thank you so much for being here this late at night and for not for being able to step away from your little one during bedtime. So any quick questions for Tessa before she heads off? Or Tessa, you're welcome to stay too, either way.
While we're waiting for questions, if there are any, I just want to acknowledge these comments in the chat. I agree that this is what's happening in a lot of areas, that not necessarily women, but often women can't find childcare. And so they're staying home. And if they're going to be home taking care of their kids anyway, they might as well take care of a few additional kids. And so they end up with a bit of an informal childcare center. And it's a way to balance their paid and unpaid work. So they're generating a little bit of income, but then also finding a solution, not the best solution in a lot of cases, or I don't want to say best, but not the preferred solution to their childcare problem, but it does seem to be the way it is for a lot of families, a lot of women in particular.
Yeah, and I do just want to reiterate too, and Rachel alluded to this earlier in the call, that there is a project in the west and northwest section of the state that is really, WICA's leading it, really looking at like, how can we get some of those informal caregivers licensed so that they can get the same kind of, subsidy, like the same access to the resources that are available to those who are licensed. So, there's checks and balances with that too. So, safety is certainly something to consider if someone chooses to become licensed. So, just as something, as a way to like think about that upper northwest part of the state, which is such a childcare desert. So there is some efforts that are happening up there too. All right.
I
So,
had one quick, can I ask one quick question?
of course.
So what is like the reach of your research? Like, do you have a sense of like who looks at this, like who uses this? Like, because I feel like this is such good information. And I wonder like how, can you tell us like the path of how what you are doing in your research like gets in the hands of people who can have some power to actually make decisions based on that?
Sure. So I will talk to almost anybody who will listen. So, I have been on WPR. I have been with a lot of local economic development groups. So local, we have community-based economic development groups. I have been on stage with all of our professional economic development. So the Wisconsin Economic Development Corporation hosted a summit in September, and they had 600 economic developers in the room, and they asked me to be on a panel, and they opened up the floor of like, Tessa, well, what else have we not talked about today that you think is important? And childcare, I think childcare is important. And occasionally I get invited to the Capitol, and they want to know about a labor shortage and ask me what I think is important. And there are a lot of things that matter, but childcare is something that I bring up. I don't get those opportunities as often, but certainly when I have the ear of an elected official, and when I have the ear of somebody who is thinking about economic development, oftentimes in a traditional sense doesn't include childcare. So I like to shine a light on the childcare issue. So it's a lot of community forums. It's a lot of one-on-one conversations. It's a lot of me being invited to be on a panel, occasionally getting a larger microphone or by larger, I just mean potentially more impactful in terms of working with those elected officials. We do have a really large listserv. So I'm part of a group on campus that does a lot of economic development work. And every time we release a piece of research or a report, it goes out to anywhere from, I don't know, there are hundreds of people on our email list that we've worked with over the years. So that would include, for example, our several elected officials have chosen to be on our listserv, so they're getting our fact sheets about childcare and that sort of thing. So I've rambled now. It looks a lot of different ways. The group that I work with and myself, we're happy to visit communities, visit statewide conferences, visit small meetings, and talk about these types of issues.
Thanks, Tessa. And I will say too that Christy, like you guys as parent leads, when you have the opportunity to talk to legislators during public forums, or if there's any meetings that will happen closer to the budget season, that's also a great opportunity to share some of the data that's either happening in your community or statewide. And, you know, the great stuff that Tessa shared, let's talk about like ways to incorporate that into conversations. I'll also add too that we have lots of legislative visits coming up. We also have businesses as well as legislators coming together in different districts throughout the state. So that's another opportunity where we share lots of like the good data that Tessa just shared, so that businesses can say like, okay, now I kind of see like where some of the shortages, like why I'm not getting employers to actually come into work. So there's lots of good opportunities, many of which Tessa shared as well, to get that word out so that legislators understand the full real picture of what's going on.
Yeah, I in particular really value this connection of personal experience with broader data. I think that that's so compelling. I think it speaks to like hearts and minds. And I think it's really powerful to use our personal stories and data together. And so I'm glad to be with you all tonight. And yeah, it's really important. So thanks for having me.
So that is an awesome segue to like starting to think a little bit about how your stories do actually connect to some of this data and what that feels like. You know, based on some of the good data that Tessa just shared, you know, really thinking about data it illustrates a need, you know, as some of like the numbers that you just saw from what Tessa shared, it's like, holy Toledo, like we're in a pretty dire situation. So it's definitely showing, you know, if you're looking at an Alice report, for example, from United Way, like what it actually takes to raise a child in the state of Wisconsin. It also reduces that uncertainty. And in some of our conversations with legislators, you'll feel that uncertainty, whether they say something outright or not. And by having good data, it's a good way to be like, this has been researched. This is from, you know, 1,000 parents. Like we know that this is true because we've heard it consistently over time from this many parents. So it does reduce that uncertainty that sometimes we sense, and maybe not even with a legislator, maybe it's just someone in the community. So it's a good way to kind of anchor that in like some really good black and white data. It also is, you know, there's a lot of public opinion, especially with social media out there. There's often times where people believe that what they think is true. So it's another good way to really look at the black and white. And then it also, like, you guys are, those of you who are parents, and maybe if you're lacking childcare, like, you know what it's like. You are hearing from providers, you're hearing from those mothers in particular who are saying like, I can't go back to work, so I'm going to just start taking care of a couple other people or a couple other kids. So it substantiates those things that you know is actually happening, and it gives some validity, and I'm saying that in quotes, to the listener. You know it's true, but a lot of people, like, they feel like if there's not good data, like it's not the truth, because they feel like it's just opinion. So it's another good way to actually really, you know, add some weight to what you already know in your heart and in your head. So Rachel, on the next slide, I think we're gonna take a little time to practice that. Oh, so here, no, we're not actually gonna. So this is a good example. Rachel, kudos to her for coming up with this. So this is like a good differentiator between like the head and the heart, right? So the story by itself is from a family member. We're spending so much on childcare every month that we had to take on a second job just to pay our minimum bills. So that is absolutely reality. And then if you look at the data, which aligns with what Tessa just said, the average annual cost of infant care in Wisconsin is close to $13,000. That's for one child. So if you think about how those two can come together, it will look like the average cost of infant care in Wisconsin is close to $13,000 per year. With two kids, our family was paying more than 30% of our annual income just on childcare. To keep a roof over our heads, we had to take on a second job. Now we barely have time together as a family, and we know we're not the only ones in this situation. So it really talks about, you know, the repercussions of what has had to happen because childcare is so incredibly expensive. And if they want to go to work, like, they have to find childcare unless they have relatives or some other way that they can actually provide that. So it's creating the connection between, here's the data, it's, you know, really like what hits home is that 30% of our income is just on childcare. Like that's a really telling statistic. And that alone, you know, it doesn't have as much, but when you're like talking about like, this is how this has actually impacted my life, that's when it really comes together, and it sits well because people understand how much it costs and then how it impacts a life, or many of our lives in Wisconsin. So on the next, go ahead, Rachel.
Yeah, so we're gonna have you kind of like pair up the stories with the data. So
Oh shoot, I forgot.
you are all super smart, and this is gonna be very easy for you. And I'm sorry that we're doing this, but I think for a lot of us who have not been in school for like 10 plus years, that talking about data can feel very intimidating and scary. And so I'm just trying to like illustrate that it is easy. It is going to be very clear, I think, like which stories and which data will connect to each other. So if you want to put it in the chat box, or if you want to speak out loud, that's great, and we can kind of talk through it. But basically, pick one of the stories on the left with one of the data sets on the right, and they will match up to each other. Does anyone have any thoughts or guesses so far? How would you pair these up? Let's go ahead and start with A. I think we'll just do it in that corner. So if you hear from a parent, or if your story is you couldn't find any childcare in your area even after calling 40 listed providers, which data set on the right do you think like backs that story up really well?
And I think Kayla has that one in the chat.
Oh, do you? Sorry. Well, okay. So Alicia's on top of it and did all of them. Great. So yeah, so A2. So this person can't find providers. Data backs up that 70% of rural Wisconsin is considered a childcare desert. And so these are just random examples of both stories and data. There's a ton more data. We're not, used to these. So B, childcare costs us so much money that we had to take another job. Like Alicia just wrote, childcare is affordable for only 6.5% of families in Wisconsin, which Tessa talked about. C, I had to quit work because we couldn't find anything. And then there's data to back that up, that women have lower rates of workforce participation than men in the same age brackets. No, that's great. I told you to do it in the chat. You're on top of it. And then you have this story of, you found childcare, but then someone shut their doors. And I've heard that from many of you over and over again, that part of the challenge is just your kids having to adapt to different providers, and the stress that means that you are figuring it out, not just once, but like over and over and over again through the years that your kids are in care. And so talking about 60% of childcare providers closing their doors during the pandemic is a really good way to connect that information. So what time is it? So it's 8:44, and I do want to be respectful of time. We were going to have a group discussion about what data stood out to you and what do you think will resonate with decision makers, and then have some time to practice it in small groups, telling your story connected to that data. I think we're going to shift the practice session to your in-person time together when you meet. So your parent leads are coordinating in-person gatherings. But I would love to hear if there are one or two things that y'all do want to share about the data real quick. Was there anything that shocked you, or was there anything that you think is a really powerful statistic?
Something that,
Go ahead.
From Tessa's data that she shared, or if you remember from Jackie's slides last month too.
Go ahead, Alicia.
Okay, for me, I think it was that 98% of occupations pay more than what childcare workers earn. And I did mention that in my group to other ladies. And when I mentioned just kind of a ballpark of what I thought that they made per hour, I was thinking it was 9 to 10. They were the first thing out of their mouths was like, wow, they would just go work at McDonald's instead.
Yeah.
They would make more. And that's not okay. And it's like, yes, okay, you get it. It's a problem. We should not be paying our childcare workers. I'm sorry, the same thing that we're paying people that are working at McDonald's. We should be putting more money into that. But anyway.
Absolutely.
Yeah, it makes sense why why one of the big issues that Christy had shared, and it's in a lot of other regions, is availability.
Mhm.
Providers are shutting their doors. Why? Because they're getting paid $11 an hour without benefits. So, I would love if you all, I mean, we'll send out the data for you to look through and you can talk about this more and think about it. We are going to send you home with like some homework as a group. So what you're going to be doing is looking up local data. So Tessa mostly shared from state level, some federal information. And what we want to have you all do is focus on like what is happening in your county or in your region. So how many providers are there? What is the median income? Some of that information to be able to tell your story from a very localized level of like, I live in Mineral Point and there's only 2 providers in Mineral Point and the wait lists are this long and this long, to help substantiate it. So when you are collecting data, we're sending you with recommendations of where to look for it, but you might look other places too. So make sure you're getting reliable sources and accurate reporting. The examples on the bottom are like bad examples, to be clear. We're going to like talk about them. Obviously for you to be like, every single parent in my Facebook group has complained about childcare access. That's a great thing to chat about with your friends when you're like proving your point about childcare. But when you are talking to somebody who you're really trying to convince, it's going to be more helpful if you were like, according to the US Census Bureau in 2016, you know, here's the facts. You want your data to be relatable and understandable, so we don't need to be talking about South Dakota. It is irrelevant to us right now. It's not useful information. And then you want your data to connect to a specific goal. So in this situation, we are talking about the child care counts request. So so even though like this last one is talking about childcare, it's not related to the ask right now necessarily. So we can talk more about that. But so next steps, so your group homework, like I mentioned, so in person when you get together, you're going to be collecting local data. We have like a worksheet on that. Your personal practice is to keep telling your story to new audiences. Try to do something like a little bit scarier every month. If you can put data in your story with it when you're talking to somebody, that would be awesome. And then our next workshop as a group is going to be on December 15th. And that will be how decisions get made in the state budget. So what we would love for you is if you do know other parents in your area who want to get involved, it is not too late. We do have recordings we're taking the recording right now for this workshop, and then we have the previous one that we just need to finish editing. So people can get caught up, and that is okay. Jackie, do you have any last thoughts?
So one other quick thought too. So even after the last recording, we're going to package them and have all 3 recordings available, because you'll have parents who come in, you know, even in January, parents who are interested in getting involved in this work. So they'll have access to all the videos. And then we also, just for those of you who might be new, we'll do trainings for a couple months, but then we're also going to have some very specific budget ask that will, you know, whether there'll be public forums, which will help you go there as a group, or it might be an email that everybody's sending on the same day, or maybe a text that's all going to happen on the same day. So there will be very specific targeted approaches that we'll have once budget season kicks off. So don't feel like you need to like create all this on your own. We'll help guide you, and we'll be there like holding your hand along the way, so that you don't have to go to a public forum. You know, if you're scared to do that, like we can certainly go with you guys. So you know, I really want to thank you guys. It's so late at night and you all are here and we're talking about data and you know, some really dire situations. So I just want to thank you so much for being here.
Yeah, can I have a second to,
Yeah.
I see all you Mineral Point, Flatville area people on here, and I am so glad you're here. Thank you for coming. And I know you all are sick, and I know you all have like crying kids in the background. So I super appreciate you all being here. And I hope you can all come to our little knitting gathering at Joy's. I'll send out another reminder about that. But I am just full of gratitude for all of you for being here tonight, in spite of probably all the coughing going on at your house right now, or crying. So anyway, thanks everybody.
Oh, and Christy, we have so much gratitude towards you and the other amazing parent leads too, who are doing such good work in Sheboygan and, way up north and in the west. So there's a lot of really good work going on. So it takes a village, and you guys are certainly an amazing part of that. So thank you so much for doing all this good work with us. And Rachel, for being such a great leader in all of this as well.